Universally, nursing mothers are advised to breastfeed their babies exclusively for 6 months. In Ghana, just like many other countries, working mothers are entitled to 3 months of maternity leave. The allotted period has sparked a lot of discourse, with many calling for an extension. In the absence of the extension, others say companies must provide nursery facilities to allow for mothers to take their babies to work. The worrisome phenomenon ironically affects health workers who are preachers of the importance of exclusive breastfeeding.
It's very stressful. As I speak now, I have a 4-month baby at home and I run morning duties. When I come, as a nursing mother, you have to close early as maybe 1:30 you'll be home. The normal closing time is for morning shift is 2 to 2:30. But as it is now, we are not even able to close at 1 or 1:30 because we end up doing a lot of things in the morning. If you have to attend to a patient, you can't leave the patient and go when the afternoon nurse is not in. It's not that they want to be late, but sometimes traffic and other issues. And sometimes the workload is too much that when they come, handing over takes a lot of time. So we are not able to close early to go and take care of the baby.
I'm not able to breastfeed my baby till 6 months. So most of the time I feed after I close from work. So he depends on the other foods. So at the end, the baby turned out to get sick and I'll be called at the workplace. So I have to rush and then get home to take care of the baby.
Medical Director of the Greater Accra Regional Hospital, Dr. Emmanuel Sropenyo, highlights the consequences of non-adherence to the exclusive breastfeeding formula.
When the baby does not get this adequate breastfeeding, then whilst the mother is at work, during that period, the baby is forced to, the caretakers are forced to give formula, or if they have a good storage system, sometimes they can express the milk and store, and then the baby gets it for the period of time. But then there is a greater tendency that the baby will be given the formula. Now, this is a cost. For the first thing is that it's a cost to the family. The second thing is that the formula is not as natural to the baby as the breast milk.
President of the Ghana Registered Nurses and Midwives Association, Dr. Kweku Asante Krobia, however, reveals to Citi News that a consensual policy has been initiated by the managerial bodies of the various health facilities aimed at establishing nursery facilities in all health institutions.
The concept has been embraced by the Ghana Registered Nurses and Midwives Association with the hostel facilities that we are putting across the country, especially those that have been dotted in health facilities. The one in Kolebu, for instance, is here just within the compound. We've built a hostel and we are considering going the second stage by providing a crèche for the facility. In fact, it was based on that even the management of the teaching hospital offered that land to the association to build. So we're going to consider that.
Our checks reveal that Rich Hospital and a few other health institutions are far advanced in plans to roll out this policy.
Management has taken a firm decision to create and set up a crèche where we will get nanny professionals who will receive the babies. Once the woman resumed from maternity leave, they will receive the babies there. And so when the nurse is coming to work in the morning or in the afternoon, he comes along with the baby.
When you go to Comfort Noche Teaching Hospital, the regional branch of the Ghana Registered Nurses and Midwives Association has a Nightingale crèche there. That is helping a lot of the women in our working class. That's a typical example.
Although this goodwill policy now exists, there is still the concern about the non-existence of compelling clauses or disciplinary structures which will deal with health institutions that do not comply.
Personally, I think they should extend the 3 months to 6 months maternity leave. I've heard people making noise about it. Others are protesting, others are also for. But I think they should extend it to 6 months. It will help. 6 months, the immunity has become strong. The baby can tolerate other feeds. And when you even leave the baby into somebody's care, like a nanny, at least you are confident that your baby is strong and somebody can really handle the baby well.
I will be the first person, as I said, to advocate for the extension of the maternity period for breastfeeding mothers. What that will provide for the breastfeeding mother is that you will have adequate time, you face less challenges to ensuring that 6 months continuous breastfeeding is attained.
Government really, and the ministries who are involved in, particularly women, Ministry of Health, Labor, and Gender Ministry, they have to maybe have a national discourse on this issue so that we can all have a way forward as to how we should go. They will provide the leadership and then the policy directive, and then we have no choice but to follow it.
It is unfortunate that the health workers who preach about the importance of exclusive breastfeeding and who are mandated to look out for other nursing mothers are unable to practice what they preach. The onus now lies on the powers that be to ensure that measures are put in place to ease the burden on these nursing mothers, not only those who find themselves as health workers as well, but every other nursing mother across the nation. Reporting for Citi News, Phyliss, Lankai, Lamptey.